Hi, everyone. Thanks so much for joining the latest episode in Grouper's webinar series, Why Social Connection Matters to Your Health. Today's webinar, Colorectal Cancer Awareness Month, What You Should Know, covers important facts and lessons about colorectal cancer. Some of you may already have experience with this personally or through friends or loved ones. March, if you may know, is Colorectal Cancer Awareness Month. Colorectal cancer is one of the most common, but thankfully most treatable cancers affecting about 1 in 4 Americans. My name is Dr. Theresa Soriano, the Chief Health Officer here at Grouper. After over 20 years taking care of older adults in the community, I see how meaningful social connections with others are critical to staying healthy and even from recovering from serious illness. I'm excited today to introduce to our Grouper members a special guest and longtime colleague and friend, Dr. Matthew Weissman. Dr. Weissman is currently Chair of Medicine at Maimonides Medical Center in Brooklyn, New York, an adjunct professor at Icahn School of Medicine at Mount Sinai. He is also a co-chair of New York City's Citywide Colorectal Cancer Control Coalition, also known as C5. Say that 3 times fast. We first met about a decade ago when our shared passion about community partnership in healthcare brought us together to co-lead a large committee related to this type of collaboration. We've since supported each other professionally as colleagues and over time as friends, and have kept in touch even when our work is ended. So it's a special treat to reconnect today with Dr. Weissman. Before we start, I want to remind our community that this webinar is not intended to provide you with specific medical advice, and we encourage you to consult with your own provider if you have any questions related to your health or from this webinar. So let's get to it.
Thanks for the
Hi,
introduction, and thanks so much for having me.
Of course, of course. So as I mentioned, March to this month is Colorectal Cancer Awareness Month. Very exciting. What do you wish, Matt, people knew in your work, being the co-chair of that committee or that coalition, that you find that most important for people to know about colorectal cancer?
Well, I really do appreciate you having me here, and I think it's always a good time to talk about colorectal cancer screening and prevention, but never more so than in March. And it's always a good opportunity to sort of refocus on what is, as you said, one of the most common cancers, one of the most common causes of death for both men and women in the United States. But we like to talk about how colorectal cancer is preventable, it's treatable, and it's beatable. And the key to all those things is early recognition and early screening, so that we can really take care of it at an early stage or even before it manifests itself.
Thanks, Bet. It's true. It's not often that you have such control as a person and also within the healthcare profession to really beat this, treat it, and most importantly, catch it. So let's talk about catching it and screening. People groan when they hear about colon cancer screening, colorectal cancer screening. Nobody wants to do it. But as you said, it is so important. So can you talk about what this means and what age-appropriate screening means?
Sure. So, a few years ago, we lowered the recommended age for people at average risk to 45. And that's really a recognition of a couple of things. It's a recognition of the fact that the incidence of colorectal cancer is happening more at earlier ages. And so having these conversations, talking about it earlier is really important. It's a recognition of the fact that most people with colorectal cancer have no symptoms at the earliest stages. And so really having those conversations and finding ways to get screened is really important. And as you know, there are sort of 2 main categories of screening. There are these direct visualization kinds of screenings like colonoscopy, and then there's stool-based testing like FIT or FIT-DNA. And I don't think people should be scared of either of them. I mean, I think they're both pretty straightforward and simple. And I think it's important for people to know about both options, because if for some reason people want to do one or don't want to do one, it's a good opportunity to figure out what the options are so you can really pick the one that fits for you.
Thanks. Many of my patients are scared to get a colonoscopy, or to you have, even the stool-based tests. Is there anything you have said that seems helpful?
So I really do think, it's important to talk through, as a doctor, it's important to talk through with patients what the options are and what they're really like. And so I encourage everybody watching to really talk to their doctors about what these tests are like. The stool-based testing is pretty straightforward. In the case of FIT or FIT-DNA, you're really talking about collecting a stool sample and sending it for processing. FIT looks for occult blood that's hidden in the stool. The FIT-DNA test looks also for cancer mutations in the stool. And if either of those things is positive, it necessitates having a colonoscopy in rapid follow-up over the next couple of months to look for what's causing that problem. The colonoscopy is a pretty straightforward test too. What it does require is prep, drinking a solution the night before the test to prepare the colon, to cleanse as much stool out as possible, so that the person
People often say that's the worst part.
And people often say that's the worst part. The colonoscopy itself, people don't mind nearly as much as they mind the prep the night before. And then the colonoscopist, the next day goes and looks for colon cancer, obviously, but also for polyps, for little outgrowths that could turn into cancer someday down the road. And so really, to me, that's a huge benefit of the colonoscopy as the screening test, is the ability to really prevent, not only detect colon cancer, but to prevent it by taking out polyps that might turn into colon cancer someday.
Thanks, Matt. It does seem like that colonoscopy is the best thing if you can get over any apprehensions, because you can catch anything and hopefully be reassured that everything's okay. And if you do see something, they can nip it out, so to speak, and take care of it right then and there.
Absolutely. And so, that's how I present it to most of my patients. Is the advantage of the colonoscopy is if it's normal, you're good for 10 years and you don't have to worry about it. If they see polyps, we can take them out and it can be preventive. And both those things are big wins for colonoscopy. The data do say that we should recommend both tests to people because it increases the overall screening rate for colorectal cancer. And so the stool-based tests have advantages too, right? You don't have to take a time off of work. You don't have to go through that prep. They don't catch generally precancerous polyps. They really are only looking for advanced polyps or colorectal cancer. So they don't catch as much. You may need a colonoscopy after the fact if they're positive, and you need to do them at a more frequent interval, every 3 years for FIT-DNA and every year for FIT. And so, there are pros and cons for both tests.
Or is anyone ever too old for a colonoscopy?
I'm sure someone is too old. I mean, the guidelines really go up to age 75, according to the sort of most widely used guidelines. I think 75 is a usual cutoff. But I think this is really, there's data that have come out and modeling that's come out after those guidelines were released that really suggests that maybe the decision is a little more individualized than just saying 75 is an absolute cutoff. So I think it's worth people having a conversation with their own doctor. There's certainly times when we might go up to 85, certainly, depending on people's individual life expectancy and risk factors.
Thanks so much, Matt. Many of our group members are very fit and very active, and some not so much. So it is important, I think, that point you made, that the number 75 is not a true cutoff, but rather just something you should know and think about if you're over 75 and want to speak to your doctor about it.
Absolutely. And I'm happy, you highlighted exercise and activity. I mean, I think there are risk factors for colorectal cancer that,
Oh, tell us about
some we
them.
can't change, like age, but some we can change. Maintaining a healthy weight, quitting smoking, reducing alcohol consumption, having a more active lifestyle, reducing processed meats, and making sure you have more fruits and vegetables. I mean, all the things that we recommend in general to keep people healthy, those are all things that actually reduce the risk of colorectal cancer.
Thanks, Matt. This is great. So, again, our grouper members are here and active because they are trying to be as healthy as possible and see the importance of being healthy and fit, both in body, mind, and soul. And this has been really helpful, I guess, in your work with patients and in trying to be healthy ourselves. Is there anything that you'd like our community to take away from our conversation just now as they talk with their family and friends and loved ones and keep trying to stay healthy?
Yeah, I mean, that's a great point. I mean, one part of it is just to talk about colorectal cancer. I feel like people are shy. They don't talk about it the way other cancers get talked about. And so just normalizing the conversation around colorectal cancer is really important. Clearly, for people with symptoms, the things we're talking about, these sort of general screening tests don't apply. So anybody with blood in their stool, with unexplained weight loss, with change in their bowel habits, like those are all things that should prompt a visit to your doctor, regardless of your age or your screening history. We want to make sure that those things get checked out. And our mantra is really that the best test is the test that gets done. And so while you're right that colonoscopy is great because it can prevent colorectal cancer, because it can detect early changes, really what's important is that people get tested in whatever test fits their risk profile and their personal preferences. And that's really a conversation with your doctor that should start early, at least at 45 for average risk people, and even earlier for people with higher risk family history or diseases or other features.
Oh, Dr. Weissman, thank you so much. I love what you just said. The best test is the one that gets done. So whatever you're most comfortable with, that's what you should talk to your doctor about. Weigh your options and choices and get tested if you haven't already done so. It's been great to see you. I love that we reconnected and have done so this way, virtually at least. Thank you all in the grouper community for joining us on this edition of Why Social Connection Matters to Your Health. And remember, please visit www.hellogrouper.com to learn more about how Grouper is leading a movement to encourage healthy living through meaningful social connections. See you tomorrow.